Command Center co-leader here at Texas Children's Hospital, which of course in Houston, Texas, in the Texas Medical Center. I'm just going to begin by doing some housekeeping, talking about how we're going to do this press conference. It's a little different since it's in Zoom, or on Zoom, I should say, and give you some overall notes of what we're going to be talking about here today. We're going to do Q&A after Dr. V, as we all nicely call him, affectionately known as Dr. V. And after that, to kind of keep it clear and concise, just drop a comment in the chat and I'll call on everybody and make sure your questions are answered. That way we're just not talking over anybody. But here's why we gathered today. Our teams have been in the hospital along with Dr. V every day in and day out, and it is heartbreaking to see what we're seeing in the halls of our hospital. I know Dr. V sees it a lot more than I do, but just last week I saw babies in the ICU with COVID, and the numbers are up there. And here's some bullet points we want to share with you. Today's hospitalization numbers have surpassed our peak of patients during the recent Delta surge that happened over the summertime. Texas Children's Hospital has close to 70 pediatric patients hospitalized with COVID-19 right now. Overall, we have had more than 80 patients hospitalized with COVID-19, and that's including some adults. We also treat adult patients and pregnant women here in Houston. A majority of those patients hospitalized with COVID-19 are indeed unvaccinated. And just to set this into a comparison, to show you how quickly this surge is happening. Compared to last Monday, we had more than 30 people in the hospital. Those were children. The Monday before that, just 15. So it's gone 15, double that 30 last Monday, to now close to 70 in this Omicron surge. Dr. V is also going to talk about co-infection. We have a confirmed case of co-infection with flu and COVID. So those are going to be our big touch points, and of course, any questions you might have. So I'm going to turn it off now and mute my audio and my video so you guys can get a clear and clean feed of Dr. Versalovic. Dr. Versalovic?
Yeah, thank you, Natasha, and good afternoon to all here locally and wherever you are. We are happy to provide this update at Texas Children's. Obviously, it's not great news, and we know throughout this pandemic, we've been challenged many times, and we just want to assure all of our families and communities that we serve here in the greater Houston area and in the state of Texas that we're ready to serve through our three pillars of diagnosis, through testing, treatment of children and adults who need care here, as well as prevention through vaccination and immunization. We have staggering numbers here during this Omicron surge already. During the month of December, this all transpired basically from 0 cases when we began the month of December 2021 to a positivity now approximately 30% as we closed the month and began a new calendar year over the weekend. During the weekend, as Natasha mentioned, we shattered prior records that were established during the Delta surge in August of 2021. And those records include pediatric hospitalizations due to COVID-19 in a single day, new cases reported in a 24-hour period. We topped 700 in a 24-hour period during the past week, and record positivity. Again, that refers to the number of positive tests over the total number of tests performed. And that number had not even reached 20%. It had exceeded 15% during the Delta surge, which was high. Obviously, the Delta surge had a major impact at the same time that we were having an RSV surge over the summer. And that surge occurred between July and September. We now have a surge that began in mid-December. And as Natasha mentioned, just in the span of 2 weeks, 2 to 3 weeks, we saw a tremendous impact of Omicron overtaking Delta. We have the capability here at Texas Children's to perform state-of-the-art diagnostic testing as well as genomic sequencing of viruses. We're one of very few children's hospitals that are doing that in-house here and monitoring our own patient population. And we have documented that more than 90% of recent cases are due to the Omicron variant in children. So we know that Omicron is spreading rapidly in both adults and children at the same time that we are vaccinating thousands of children in the area. Still more than 80% of children in the greater Houston area have not received their first shot of those school-age children. And so we are committed to, of course, continuing to advance immunizations in this new calendar year. At the same time as we're caring for many children who can stay outside the hospital, fortunately, we're prepared to care for children that require hospital-based care, those that may have underlying medical conditions putting them at greater risk, and those who are unvaccinated. Many still, the under 5-year-olds. We now have more than 1/3 of patients hospitalized in recent days in the category under 5 years of age. And unfortunately, those children still do not have access to a vaccine. We're working on that at Texas Children's. We're continuing those vaccine trials, of course. But I want to also just assure everyone that we have learned plenty during this pandemic, and we're in a much better position this January versus last January, with vaccinations and boosters now available also, not only to older adolescents, but today we had FDA authorization for those 12 to 15 years of age, and we can comment on that. We're awaiting CDC approval on that. The Texas Children stands ready to provide boosters to adolescents as we continue to vaccinate school-age children. I will add that we are continuing to set records in terms of diagnostic testing. It's important to continue to test to accurately diagnose COVID-19. We know that influenza is circulating. Natasha mentioned that we have documented just in the last few days our first confirmed co-infection of influenza A and COVID-19. Fortunately, that child is doing okay outside of the hospital, but we continue to monitor this situation carefully. We have diagnosed more than 90 influenza cases in children since Thanksgiving. So though we are not seeing anything approaching a twindemic, we continue to see other respiratory viruses circulating. And fortunately, RSV numbers remain low. This is not the story that we saw in the summer of 2021, but it is a tremendous surge in terms of absolute numbers because Omicron is extremely contagious, more contagious than Delta, in the category of measles virus. And due to its rapid spread, of course, it's impacting many children and adults. And at the same time that we are trying to get vaccines to as many school-age children as possible. With schools resuming tomorrow, Texas Children's is working closely with schools and school districts. We met with school district superintendents last week in Region 4 here in the greater Houston area, and I want to assure everyone that we are doing our very best to inform the school districts, to keep them current, and of course to inform families throughout our communities that we serve. I think with that, Natasha, if it's okay, we could segue into questions unless you want me to cover anything else.
No, I think that's great. You hit the nail on the head with school districts. The only thing I would like to mention to everybody, we continue to see in our emergency rooms and our urgent cares, in our emergency room, more than 200 people a day to come in for all different kinds of cases. So if we could hit home again that people could, if they don't have a real emergency, seek other places to go to for COVID testing rather than our emergency rooms. Let's get to our first question. This is from Adriana Rodriguez from USA Today, and she's asking Dr. V about the co-infection that case you just referenced. Wants to know if it's a pediatric patient, are they hospitalized, are there any other details that you can provide? And then she has one more question after you answer that.
Well, what I can say right now, we have a single case confirmed. It is a child, and fortunately, that child is not hospitalized at this point in time. We are continuing to monitor the local spread of influenza and COVID-19, the Omicron variant specifically, since we are, of course, needing to remain vigilant that more co-infections could occur. We documented a number of co-infections. Texas Children's was the first children's hospital nationally to report co-infections of RSV and COVID-19 during the July and August months of 2021. And we do know that many of those children required hospital-based care and some required critical care. We know how to care for each of these infections, and so we're prepared to care for these children.
Follow up to that from USA Today on the co-infection question. Does co-infection mean more severe disease? Is one virus beating another? Is there more viral load of the flu or SARS, COVID? How does that work?
We will certainly need to wait to deliver anything definitive about this. Right now, it's just too soon to tell. Again, this is one confirmed case, and of course, we'll be working with our colleagues across the country to see if there are more cases and whether we see any distinct pattern of these cases. At this point, we can't comment on whether it's more severe. We just know how to care for children with influenza and with COVID-19. And so like we saw with RSV co-infections, certainly we're prepared then to combine strategies to care for these children. But at this point in time, we really can't say very much about the pathology and what this means in terms of disease severity, other than we need to monitor this situation carefully.
All right, next question's coming from CNN, Miguel Marquez. Miguel Marquez is asking that Omicron, we've heard, might be, it's more transmissible. It might be more, maybe less severe. It's attacking the upper respiratory rather than the lungs, we're hearing. So good news there, but it may mean greater levels of illness for children. So he wants to know, are we at TCH seeing the trend? Can you speak to why viruses that attack the upper respiratory are more harmful to kids?
Well, first of all, we can't definitively make that connection yet. There's no definite connection between this upper respiratory presence of Omicron, possibly a preference of Omicron to the upper respiratory tract. We're certainly studying that carefully, but it's too soon to tell in children. And even the data in adults are still rapidly evolving during this relatively recent onset of this Omicron surge. Less than 1 month ago, I want to remind everyone, we're less than 1 month into the surge in the United States. It is important, though, to note that though it does seem, and though some data now are certainly coming forward publicly about hospitalization rates in the United States that may be lower with Omicron, we still don't have a firm handle on that for children. We are aware of data from Southern Africa indicating that the youngest children may be more vulnerable to hospitalization with the Omicron variant. We're following that. We have more than 1/3 of cases, as I've mentioned, in the under 5 category in our hospitalized population during this Omicron surge. So it is something that we are going to watch very carefully. We have no firm evidence that the disease is more severe with Omicron than with Delta at this point. I want to be clear about that. But we also cannot say that this is milder for children because it is frankly early, and we just need some time to continue to follow these children and see, really gather more data about the outcomes.
All right, moving right along, Business Insider Hillary from Business Insider says, what percentage of children being hospitalized are there or are here in our hospital because of COVID versus coming in and being admitted for something else and then testing positive at the same time? Has that percentage gone up or down significantly with Omicron?
We don't have an exact number, and really no hospital has an exact number, because as we care for patients in the hospital, we are, of course, working through the differential diagnosis and determining whether COVID is the primary factor, could be a cofactor. In other words, a patient with an underlying medical condition with COVID-19 perhaps being a contributing factor to the hospitalization. What I can say is that as we're examining the data in real time, it's clear that the majority of cases either have COVID-19 as a primary factor or as a significant contributing factor to their hospitalization. That said, of course, we're going to need to continue to study this to see if we can get firmer numbers on that. The reality is that Omicron variant is making a real impact in children as well as adults. What we have is, even if the hospitalization rate is lower, and we don't know that for children yet here in the USA, the reality is that even a smaller part of a really big number, meaning more children infected with Omicron, still translates into a big number of children who may need hospital-based care and may need emergent medical care. We are still early in this surge, so it remains to be seen what the impact of MISC, a potentially life-threatening complication that we saw with the Delta surge. We still need to see how that may unfold in the weeks ahead. And we still need to see what the impact of Omicron may be on patients in terms of long COVID. I'll just mention that as well.
Okay, let's get to boosters now. A question about boosters. Lots of talk in the press about 12 to 15-year-olds getting FDA approval on that. Once we receive the full approval on that, how soon will we be able to vaccinate 12 and ups for boosters?
Yeah, so it's a great point. We're certainly ready to advance the mission of disease prevention through vaccination for children as well as adults. The younger adolescents, 12 to 15 years of age, first received access to vaccines back in May of 2021, just as a quick reminder. They are now in a time frame where boosters could have a significant impact in continuing to protect them. We're already seeing plenty of evidence as outside of the US and within the United States that boosters offer a significant level of protection against the Omicron variant in terms of disease and protection, in terms of disease prevention and protection, I should say. So we're ready to move within the coming days. This is now an emergency use authorization by the FDA. I want to be clear on the word authorization by the FDA. And then following that, now the CDC is deliberating and reviewing that under the direction of Dr. Walensky, director of the CDC. We anticipate hearing from the CDC within the next 24 to 48 hours. And we are ready to then immediately pivot to providing boosters to younger adolescents as well as older adolescents.
Okay, great. Channel 2 with the next question. I think Dr. V answered the whole, are people coming in with COVID complications or just illness, injury? How does it work? So you answered that one. They're also asking if we can give a more specific timeline for when the hospital is submitting data for our clinical trials, the Pfizer clinical trials for children 4 and under to get a vaccine. We can answer that offline since I think that's more of a Dr. Munoz question, so we can get back with you on that one. Next up, staffing shortages. Are we running into any of those as a result of Omicron, either from cases or exposure? Dr. V, I'll let you handle that one.
Yeah, let me just make one comment, Natasha. We, on the vaccine trials, we are in the midst of the under 5 trials, and these trials have had to be extended for good reasons, just to make sure that we have vaccines that are maximally effective and safe, and dosing obviously is being optimized for the youngest children. But just know that Texas Children's is certainly playing a key part in advancing these vaccine trials for children under 5, and we're committed to seeing that through in the next few months. I will just then pivot to the staffing question. The reality is that we have plenty of bed capacity here at Texas Children's right now. I can certainly confidently state on the 3rd day of January of 2022 that bed capacity is not an issue. We have ICU bed capacity, hospital bed capacity. We certainly are keeping our emergency centers and urgent care centers open 24/7 for the families that need us. And the key emphasis here on staffing is that, yes, Omicron variant is having an impact on our staff and their families. And of course, they're parents of children as well. And so we're working diligently around the clock to make sure that any staff who need to be out for COVID-related reasons have their time covered, of course, and that we are fortunately able to have sufficient depth now in our healthcare teams to provide round-the-clock coverage here at Texas Children's. So we remain open and ready to serve for the families that need us. So I just want to reassure everyone that our census honestly dipped a little bit during the holidays, as we see every year, and that has certainly enabled us to continue to have the capacity we need, both operationally and in terms of beds, for the patients who need our care.
All right, Dr. V, New York Times has a question. Can you tell us more about the hospitalized children? Do they have risk factors that have possibly worsened their COVID disease? Can you say anything about the demographics? Or some communities are you seeing affected more than others?
I can make a few comments. First of all, in terms of age groups, we have three basic categories that we look at, and then we can stratify further as need be. First, the under 5-year-olds, since they are wholly unvaccinated. We, of course, know too that the youngest of children need special attention as their immune systems are still developing. We do have more than 1/3 of children hospitalized during this Omicron surge under 5, and we are seeing cases of viral pneumonia and respiratory distress, serious lung infections in children even under 2 years of age. So there's no question that Omicron is making a real impact in the youngest of children. We know that school-age children are being hospitalized. We've looked carefully at those numbers, and though the percentage is a bit lower for school-age children in that 5 to 11 category, we currently have children hospitalized in that category. These are unvaccinated children, mostly, who are still getting access. Some may be partially vaccinated. They have, many of them have underlying medical conditions, but some do not have a known underlying medical condition. So it's hard to predict who may need to be hospitalized. We do know that conditions such as Down syndrome, diabetes, certain forms of pediatric cancer, lung and heart conditions, and obesity may put children, including adolescents, at greater risk for severe COVID. And that certainly is the case during the Omicron surge so far. We expect to see more of that. We continue to see an impact on adolescents, still many adolescents unvaccinated. We continue to see adolescents hospitalized with COVID pneumonia and respiratory distress. Some of these children do require critical care. So we are continuing to track the impact of Omicron, in addition to testing by sequencing these variants and confirming that we have more than 90% Omicron cases thus far. We'll continue to track that and then continue to see how these children do. And as we get more cases, continue to see whether any new patterns emerge during this surge.
Okay, up next, what can be done now to slow the surge, since most of these kids that we're talking about are too young to get vaccinated?
Well, importantly, I think within households and families, we need to start with parents and adults in the household who can be vaccinated. If they haven't been vaccinated, to please get vaccinated. If they haven't been boosted, to get boosted. We know that boosters are playing an important role in mitigating the full impact of this Omicron surge already. And we know that anyone 16 years of age and above right now does have access to boosters. So for those younger children who may have older siblings, getting those older adolescents vaccinated and boosted is certainly very important. Time is of the essence. I've said this before. It's a race between the vaccines and the variants. The variants get faster. Omicron is faster than Delta. Delta was faster than Alpha in terms of the rapidity of spread. And so we can't waste any time in terms of vaccinating adolescents, adults, and school-age children. Of course, in terms of immediate protection, nothing works as well as a mask. In children who are still waiting to get their second shot, those who may, of course, need time to get full protection, because that takes 2 weeks after the second shot, so a total of 5 weeks from the first shot, then the only immediate protection is masking. We need to continue to promote masking in schools, masking out when children are out and about, and particularly in crowded indoor spaces. And in households where there may be a known case of COVID or known exposure, masking can continue to be important as a source of protection. And then finally, of course, keeping sick children at home, just as we are recommending for adults. It's important that we all do our part to mitigate the spread, to not put other children at risk when we can prevent that by simply staying at home. And we're just going to need to be mindful of that. We expect this Omicron surge to peak during this month of January. And of course, time will tell. But these are some key elements that we all need to keep in mind in the days and weeks ahead.
All right, let's see, next question here on the chat. It had to do with the flu. Yeah, there's a couple of them. So let's first get to this. Those patients, those children that are co-infected with COVID and the flu, is the antiviral proving to be effective for the flu? What information can you give us on that?
Well, we certainly stand ready to give antivirals. Again, I want to just emphasize that we only have one case of co-infection right now. We only have one recent RSV COVID co-infection case during this current surge. So these numbers, fortunately, are very low because we have relatively low activity of both influenza and RSV this winter thus far. That's obviously in stark contrast to the situation back in July and August during the Delta surge when we had a surge of both RSV and COVID. So we were dealing with many co-infections. Of course, we know antivirals will be effective, can be effective against influenza. Depending on the timing of administration, we'll stand ready to treat these children as we're doing currently. We know how to treat RSV infection as well. We don't have a vaccine for RSV. We do have a vaccine for flu. We want to continue to emphasize the importance of influenza vaccines for both children and adults as well. And then finally, we know that other respiratory viruses are circulating, and this emphasizes the importance of diagnostic testing. When children have symptoms of concern, we need to make sure they get tested so we know how to distinguish these infections and how to diagnose a co-infection so that we can treat these children appropriately with antivirals and other supportive measures.
Okay, this is a good one. Dr. V, are you seeing cases with children who are vaccinated?
It is just hard right now. There are just so few children that are fully vaccinated that honestly, I don't have an answer for that now. I don't think so. If we have it, it'd be very rare. Keep in mind, we began administering vaccines to school-age children in early November, less than 2 months ago. It takes 5 weeks from the date of first immunization to get full protection, even if that child was lined up ready to go in week 1. So the reality is, with more than 80% of children in the greater Houston area still awaiting their first shot and 90% or more awaiting their second shot, the reality is that we're talking about a tiny group of children that have full protection at this point. So though we are still working through that, what those numbers are exactly, right now, it's fair to say that the vast majority of the children that we're seeing right now are unvaccinated. Now, with adolescents, that's a different story, but I can tell you so far, it seems that almost exclusively we're caring for unvaccinated adolescents. So this is what we documented clearly during the Delta surge. It's still early in this Omicron surge. But clearly, thus far, I think one message is clear, and we've learned it primarily from adolescents thus far, is the importance of vaccination. We anticipate that children now, as more and more are become fully protected due to the vaccines offered in November, that we will see that same level of protection as well.
Okay, let's get the next one here. Let's see, are you able to administer the new oral medications for COVID in conjunction with the antiviral for the flu?
That not yet. You know, the issue on that is the approval of being able to use these oral medicines in children. Of course, this is still new for adults, but fortunately, we have new medications that are coming online. We are obviously going to be following this very carefully in terms of authorizations and approvals of medications for children. We do have combination medication strategies for our hospitalized patients that includes antivirals for COVID-19, and certainly we stand ready to offer those for hospitalized patients that need such care.
All right, let's get to the next one on the list here. This one's from the Houston Chronicle. Any more information about the increase in pediatric hospitalizations? For instance, whether kids are becoming sicker than in previous surges. They've asked if we've had any deaths at TCH. Do they have other illnesses or just COVID? I know you touched on this with the co-infection with flu and COVID, that we had a confirmed case of that. If you could just clear that up for people.
Yeah, I think right now we're dealing with a numbers game, frankly. And that's really the headline right now, is the fact that we're dealing with the most contagious variant to date in this pandemic, Omicron. that it's infecting record numbers of children as well as adults because it's spreading so rapidly at the same time that we are trying to deliver vaccines to school-age children. Of course, it's making a real impact in children across this country. The severity question is a good one, but right now we can't say whether this disease is more severe at this point. We just know we have many children who are unvaccinated still, and of course under 5, wholly unvaccinated. We're going to have to just continue to monitor that. I guess I hope I'm answering the question as well clearly. Let me know, Natasha, if there's an element to that I've missed.
Okay, no problem. Moving on, trying to get everybody's in. Our providers recommending the new CDC guidance. Tons of news on that. A lot of people talking about it, specifically the changes to both the quarantining time and the isolation time frames. There's been a lot of people wondering about that.
Well, we are making adjustments definitely in our healthcare organization around enabling people per the CDC recommendation to come back to work after 5 days instead of the required 10 days following a positive test. Again, depending on their health status, depending on their vaccination and booster status, we're approaching that with these different tiers. We know that there's concern around children being in school. We want them to be in school. We want to be clear about that. We're working closely, as I mentioned, with school districts and school leaders throughout our communities to give them timely information, to recommend masking and other strategies for prevention of transmission. At the same time, knowing that children may be getting tested, perhaps with recent exposures, with negative tests, enabling children to be in school. I hesitate to comment too much on the details in terms of timing and where children should be, but clearly we want to make sure that symptomatic children are at home, not at school. We want to make sure that children are, of course, masking in the school environment as much as possible, being outdoors versus indoors. Yes, we are adapting to the new CDC guidelines. We're following carefully recommendations regarding testing. We want to continue to encourage parents to seek testing for their children if they have symptoms consistent with COVID-19. I want to stress some of these symptoms may be mild by themselves, but the combination is what we need to pay attention to. It can be a sore throat, nasal congestion combined with headache, muscle ache. Many unvaccinated children, of course, may have fever as well. And then if that progresses to shortness of breath and difficulty breathing, that's when clearly we need to seek urgent medical attention. But these are all symptoms that we need to follow both at school, and that includes teachers and school leaders, along with parents and families, to try and keep children as safe as possible.
Okay, here's a question from CBS in Austin. Dr. V, is there any data that shows why the Omicron variant is impacting kids more than previous strands like Delta?
I think at this point, when we put all the data together, I think it's clear that Omicron is extremely contagious and more contagious than Delta with respect to both adults and children. And we have different lines of evidence supporting that. The case positivity and the trajectory, frankly, we have had a much steeper upward slope with Omicron than we had with Delta. For example, the first adult case in the greater Houston area with Delta was detected in mid-April 2021. It took 2 months to detect the first case of Delta in children 2 months later, in mid-June of 2021. That was very different with Omicron. With Omicron, we had the first adult case preceding the first pediatric case in December by less than 2 weeks. So compare 2 months to less than 2 weeks. And that combined with the steepness of the slope and the numbers of cases that we're seeing, all the data point in one direction, that we're dealing with an extremely contagious variant that is spreading much more rapidly among both adults and children. And we've now verified that those cases in children are mostly Omicron and not Delta. And so we've seen a very rapid displacement of Delta by Omicron in both adults and children.
Okay, one other question on here was talking about vaccinations, and people are still talking about COVID and flu vaccinations at the same time. Break it down for us. Is it safe? Is it okay to get it at the same time?
Definitely. We have two highly safe and effective vaccines for COVID and for flu. I think clearly there are some individuals that may want both at one time. We know that can be a lot. We know that individuals may be, and adults and children, parents, may be concerned that their child is getting two vaccines in one day. Perhaps they feel a bit tired after a vaccine, have some mild side effects that we see with every vaccine, some arm soreness, and perhaps it would be easier on the child to have the vaccinations on 2 different days. We certainly accept that. The vaccines are entirely safe to be administered in a single day, and receiving both poses no enhanced risk, but we understand that adults as well as children may prefer to have the vaccines done separately just to see how they do after the COVID vaccine. I would put the Omicron vaccine as a higher priority right now. If I had to choose one vaccine which to get first, definitely get the COVID vaccine first, because the Omicron variant, frankly, is extremely contagious and more contagious than flu at this point. And so knowing that, I would move more quickly on the Omicron vaccine, and then certainly within a week, it could be just a day later, a few days later, get the flu vaccine. We still need to be mindful that flu is actively circulating here locally and nationally, and we expect to see more cases of flu through the winter months. And this is influenza A. Influenza A can certainly lead to hospitalization, as well as, of course, creating symptoms that can keep children out of school. So we certainly want to promote both vaccines. They can be administered in a single day. They don't have to be. I think the most important point is get both vaccines as soon as possible.
All right, this one's coming out of Dallas from WFAA, the ABC affiliate up in Dallas. Dr. V, William Joy is a reporter. He says every school district has different policies, but how should us parents be feeling with kids headed back to class, mostly all of us in Texas tomorrow, give or take a couple days? That's a big question right now.
Yeah, and we understand everyone's concern, and every parent's going to approach this a little bit differently with their children. So, perhaps some schools have options for virtual learning, and perhaps that's a reasonable option. And we certainly embrace in-person education. I want to be clear about that, but we also know that some children may have underlying medical conditions that may put them at greater risk. And so parents will need to stay closely connected with teachers and school leaders to perhaps advise them about their child who may have a specific condition that would put them at greater risk. We have that information available through texaschildrens.org, the CDC website as well, other sources if parents have questions. That would be one important caveat. I think then in general, if children are healthy, feeling well, and certainly if they've been vaccinated and now fully vaccinated, they should feel very confident about going to school. With masks. It's important to highlight that even with children who are fully vaccinated, though that's a small group thus far, it's important to note that those children could transmit the virus to other children. So we still need to endorse masking, particularly during the height of this Omicron surge. We all are weary of this pandemic, but it's important not to relax too quickly. We think this is just a matter of a few weeks now to get through the worst of this surge. So I think it's important to embrace school tomorrow with their children, work closely with teachers and their schools to monitor COVID and possible COVID spread in schools, to continue to promote masking and safe behaviors, to promote outdoor play whenever possible, and also just to make sure that we keep sick children at home. Any child who's symptomatic, now more than ever, it's important for us to do the right thing and keep our children at home if they're not feeling well. And then, of course, to get them vaccinated as soon as possible. But we do want to embrace the new school year and know how important it is for children to grow and to learn.
I want to give you a second to get some water if you need to, Dr. Versalovic. Thank you so much for all your expertise and your time. You've been very busy, so appreciate you for being here with all of us to answer these burning questions. Once again, I'll give some extra time for you guys to type in some questions while we give Dr. V a break to catch his breath. The big news coming out of Texas Children's Hospital right now is that Texas Children's Hospital has close to 70 pediatric patients hospitalized with COVID-19 right now. Overall, we have more than 80 patients hospitalized with COVID-19. That's including adults. A majority of those patients hospitalized with COVID-19 are unvaccinated. And today's hospitalization number that we just provided you has surpassed our peak of patients that we witnessed over the summer with the Delta surge. Compared to last Monday, 30 children in our hospital with COVID-19. The Monday before that, hospitalizations were at less than 15. So you do the math, it's pretty stunning where we are today. We also confirmed our first co-infection of the flu and COVID, an outpatient case, and that child is doing fine. I'm just checking the chat now. I don't see any other questions, but if we haven't answered anything, or if we could send you guys a recording, just email me or my colleagues and my cell phones on the email that I originally sent out. We appreciate your time. We also have internal and external video, B-roll that we can provide to the broadcast stations if need be. Send me an email and I'll send you a link. And it's just as long as you courtesy Texas Children's Hospital, we'll share with you. I think that covers it. Dr. V, you good to go?
I am. I just want to thank our partners in the media for helping us to communicate with the communities locally and nationally. And we do want to deliver a message of hope and reassurance to everyone. We'll get through this, and we're in a much better place here in January 22 than we were in January 2021. So thank you, Natasha.
All right. Thank you, Dr. V. And thank you, everyone. We appreciate it. Contact us if you need anything via email or through our cell phones. Have a good day. Bye-bye.